Good evening, everybody. We're going to get started, and as we'll make others feel welcome as they arrive. But what we found is our little gang up here got into it, and we realized we want you all in it with us. So please, folks, come on in. Leah, hello. Welcome. Have a seat. My name is Sharon Avery, and I am delighted to be the Master of Ceremonies here tonight. I am the very proud CEO of Toronto Foundation, and just delighted to be here with you face to face. This is not a virtual event. This is a together event. It might have virtual elements to it before or later, but it is such a delight to be face to face with a group of folks who want to come and talk about the importance of social connection. And so many thanks to the Bentway for inviting me to be here and to be a part of this evening's activities. I do have a few things I have to do, and then we're gonna have a fun little activity in a minute. Don't be afraid; it's not scary. But I just want to start, of course, by acknowledging the land that we are on, the ancient lands of the Haudenosaunee, the Anishinaabe, the Wendat, and the Mississaugas of the Credit. We are on territory, or Treaty 13 land, and I think we're here to talk about place. We're here to talk about the importance of place, and so we can't start without talking about the millennia before Toronto was Takaranto, and so want to make that acknowledgement. I want to highlight just now that we're going to talk for about an hour. There's going to be Q&A. We're going to talk about this brilliant report that the Bentway and its partners have just released. And afterwards, there's going to be a reception. And I'm going to remind you about that at the end as well. But I just want to say that now. Don't everybody jump up and leave, because the real conversation, I think, will get started once you've heard what the brilliant women at the front here are going to talk about, and you have things you want to add to the conversation. At Toronto Foundation, we've been studying social capital, which is kind of a jargony term, so I'll just break it down. The relationships that we have with each other, with our neighbors, with our family and friends, our sense of trust and safety and connection within our communities, with our big institutions. We were inspired by the work of Bob Putnam, who wrote the seminal work on social capital, Bowling Alone, back in the 90s. We weren't inspired in the 90s. That's when Bob wrote the book. We did our first social capital report in 2018, and I was telling Ilana about this. I had only just arrived at Toronto Foundation, and this was already kind of in the works. And I will admit that I didn't really get my head wrapped around social capital until we did our second study in 2022. This is survey research. We interviewed 4,000 Torontonians across the full city of Toronto in every demographic about their sense of connection and sense of belonging in this city. And no surprise that between 2018 and 2022, we saw a pretty significant drop in social capital in Toronto. We lived through the pandemic in that window of time, and we were very isolated. And so last year, one of the other pieces of research, some of you might be familiar with our vital signs report. We've actually brought social capital and vital signs together. And in doing so, I feel we finally sparked a conversation that is bigger than a research report. And to see the report that the Bentway has just put out be in any way inspired by our work makes us feel really good, but it also makes the work worthwhile. And so I'm really delighted to be here to talk about that tonight. But because we're talking about social capital, I always like to start an evening like this with a little social capital story. And so my story took place at the Bentway. And as a community foundation placed in the most diversity in the world, we are part of a family of community foundations across Canada. There's actually 208 community foundations in this country. And every 2 years, we have a gathering. And we didn't get to gather through the pandemic. So Toronto Foundation raised its hand to support the gathering taking place in Toronto in 2023. And in June 2023, we were all down at the Weston Harbour Castle, and we wanted to have, as the sponsor, we had to host a party for 800 people. And I was talking to a board member at the Bentway, who's a friend, and telling him that we were needing to find a venue where we could host a really kick-ass party in Toronto with 800 people who hadn't seen each other in 4 years. And he turned to me and he said, "You got to have it at the Bentway." And so we did. We threw a parade at the Bentway. And much to my many colleagues across the country's chagrin, I made them all walk in the parade together. And in the parade, everyone it was the day Pride was opening in Toronto. And so we had rainbow-colored umbrellas for everyone, just in case it rained, which it did not. It was a beautiful sunny day. And we had all these different cultural performers who headed different legs of this parade down the beautiful pathway of the Bentway towards an international food festival at the other end. We pulled out all the stops. But one of the elements of the parade was dragon dancers. And they were, as you know, I can just say that, and I know you all have a picture in your mind of these dragon dancers. And they are warming up in the area at the end where everyone was gathering with their umbrellas. And I glance over and I notice, because this was kind of a party of community foundations, and it was during the early afternoon. We didn't expect there to be a lot of public there. But this family had set up in some of the Adirondack chairs that sit alongside the pathway of the Bentway. And I went over to say hello to them. And they said, "Oh, are we not supposed to be here?" And I said, No. I'm delighted that you are here. And like, what brings you down here? And this lovely woman, it was a couple in their 80s and their son who lived with them in a condo overlooking the Bentway. And they said, "My father has not wanted to leave the condo for months, but he looked out the window and he saw the dragon dancers and he asked if we could come down and watch." And for me, this is the magic of Toronto. This is the magic of public space, a beautiful public space that has been created to feel welcoming and beautiful. And so I want you to take 15 seconds, and I want you to think about a story like that you have about this city. Just take 15 seconds and think, what's your story? And now I want you to turn to somebody near you who you do not know, and I want you to share your story with them. Go. I am seeing a lot of animation in these stories. I'll give you 10 more seconds. Okay, I gotta interrupt. I'm so sorry. So now each of you has a new friend to take to the reception after this event. I love that exercise as a way to make everyone in this room feel a part of this room, because I think at my core, what really lights me up personally about this work on social capital is because it's just about us being humans with each other. And that means that we're not always going to agree. We don't always have to see eye to eye. We don't have to have the same lived experiences. But connection is so deeply a part of our humanity and our health. And I think we're going to talk about that some more. But first, I want to invite up Joanna Marcovici from Manulife. She's the Managing Director of Community Investment. And I know the Bentway values the partnership with Manulife deeply. They've been a great supporter. And I'm going to give Joanna the opportunity to talk about why.
Thank you. I'm going to echo a lot of what Sharon said in terms of just thanking all of you for being here, thanking the Bentway and the team there for welcoming me to this great event. And certainly it's such a pleasure to be associated with the Bentway because, as you all know, since you're here, they're doing terrific work. My name is Joanna Marcovici, and I'm the Director of Community Investment at Manulife. And through our partnership with the Bentway, which we've been doing for a few years now, we get to be a very small part of the work that you're doing, which is not just really in our, I know it seems like it's really in our local environment here in Toronto, but it's being recognized outside of Toronto, which is really nice to see that their strong efforts are being recognized that way. And the work that they're doing that's tied to social connection in particular and addressing urban isolation really means a lot to us at Manulife because of our focus on health and well-being, which is really core to what we do. We really want communities and people that are living in the communities where we work and where we live to be healthy. And no doubt that social connection is one of those things. So I've had the privilege of living in Toronto for most of my life and could tell a number of stories to the crew here. And we know that public spaces really do play a vital role in fostering social gatherings, building that sense of community that I spoke about. And it's important that we continue to increase and enhance these spaces. And so that's why partnerships like this mean a lot to us. And that's also why the Prescription for Social Connection report, which really explores how these thoughtful public spaces can really transform cities and communities and help alleviate some of that social isolation that I spoke about. It's why it's so important. And so I won't spend any more time up here other than just to say I'm excited to dig into this conversation and to hear from all of the panelists. And I hope that you all also find it inspiring and valuable as well. So over to you, back to you, Sharon, to take it away.
Thank you. This is where the pressure's off me and on you. So welcome, Ilana, Kate, and Julia. Julia in from New York City and landed safely today. We're happy about that. So I have questions for each of you, and then I have a group question, and then we're going to allow for questions out here. But Ilana, I'll start with you. This idea of a prescription for social connection report, it really, when we were talking about this, I realized that collaboration was at the core. I mean, you can't do a social connection report without collaboration, but this idea of prioritizing collaboration and interdisciplinary approach, we don't always see that in reports. And so what perspectives did you want to include and why?
Well, the Bentway right from the get-go was envisioned as a public space, but also a platform for Torontonians and those from further away to have important conversations about their city. And we want to ensure that it was a platform that was not just for policymakers and planners and those who are often involved in these conversations, but for artists and designers and health practitioners and community members. And so each one of our seasons, we really envision as a platform first. We ask ourselves, what are the big questions facing our city? What are the big opportunities? Who do we want to invite in to share in this conversation with us? And when we were designing our season in 2024, led by my incredible colleagues here, Anna and Alex and Renee, as well as others, we were really struck by your research, the research that came out of the Vital Sign report naming Toronto Canada's loneliest city. 43% of neighbors never seeing each other. I mean, that's a staggering statistic. It's a statistic that should wake us all up. And we inherently knew that public space played a significant role in addressing the growing loneliness crisis that we were facing. But in a true Bentway style, we wanted to invite creative practitioners, artists, and designers to explore the opportunities to really address this issue together. And we had fantastic collaborators who we learned so much from. But we also knew that this was a public health issue, first and foremost, and it was essential that we had public health partners helping us to understand the role that our space could play, the role that our programming could play. And I was very fortunate to meet Kate and to learn about her incredible work championing social prescribing. The work that she's doing in the community is absolutely phenomenal, as well as Nada Hassan, her colleague, who was essential to bring this report together. And we were very lucky that they came on as partners. We also recognized we weren't the only people thinking about this. And we came across the work that Julia and her colleague Candace were leading from Gehl around loneliness and design and public space, and reached out to them and said, do you want to come, collectively, do we want to use this summer season in the Bentway as a case study to really understand what's possible and what will make an impact? And we're so grateful that everybody said yes. I mean, I think every design table should look like this, where you have public health practitioners sharing space with designers, sharing space with artists and creatives and community members. But I will say personally, I knew I was going to learn a ton from everybody involved, including the Toronto Foundation and the work that you were leading. What surprised me is that everybody brought their own methodology. And so while Kate and Nada were leading a public health survey, Julia and Candace were doing observational research across the site, seeing what sort of patterns of movement were happening in daily activities. Our artists were exploring it through a creative lens, and we conducted interviews with many people who I'm very happy to see in the audience here today. And it was amazing to see where these methodologies aligned, where they came together, and where they checked our professional biases. And I think, or things that we have stopped seeing because they're too close to us. Seating, which anybody working in public space, I think, takes for granted that seating is a component of public space. But to really understand the role that seating plays from a public health perspective, to see how our artists embraced it as a form, opened my eyes again to the importance of these design features, which unfortunately sometimes when you're too close to it, you just stop seeing it. So it was a tremendous collaboration. It's a collaboration I only hope to continue, and it's a collaboration that I know will go on to inform our future design work and the work that we do on future Bentway sites.
I love it. Kate, it makes sense to go to you next, I think, because Ilana already talked about the intentionality around public health in this space. And it feels like, well, you do interesting work that you should probably talk just a bit about anyway. But it feels like public space is like a toolkit in your public health toolbox. You agree?
Yes, I do. And it goes beyond that. That public space is public health in many really important ways. So I'm a health geographer by training. I'm very interested in people's relationships with place, with their neighborhood, with their communities, and with the leadership that happens at that local community scale that is not well recognized, not well funded, and not well connected to other pieces of work happening, particularly within the health system, public health and healthcare systems. And so we know, like in the most literal, biological way possible, that if we are not in dialogue with other people and place, we are literally not alive. Like we literally embody our geographic, social, and ecological and political conditions. And so if we see the expression of, a huge number of people living in this city say that they're experiencing loneliness, that's telling us something about our public space too. It's telling us something about our healthcare systems. It's telling us something about what we're not doing in terms of helping people to do what is humanly necessary for biological functioning, which is to be around other people and to be around nature, to participate in arts and culture. And so my work is a lot about social prescribing, so hence part of the title, which really means helping to use those healthcare connections to connect people to community in a strengths-based way. So we don't typically call it social capital in health, we would just call it like our strengths and our social health and well-being. But that's the same kind of piece of work where we want to have strong people in strong communities. And we really learned through the COVID-19 crisis, so I was on the Board of Health during that time, and working with community health centers, that the thing that helped some communities weather that particular storm more than others was strong social infrastructure at that very local level. And public space is a component of that. There's a literal expression of that social infrastructure, and having a place to sit is one of those little moments. And so we often say in social prescribing that we're flipping the script from what's the matter with you, which is the more biomedical gaze, to what matters to you. And then focusing on that, building on your strengths and interests as a person and those of your community and what's available and what's meaningful, and helping you to together build self-determination, some autonomy over your decisions, a reminder of your sense of capacity and purpose in the world, a sense of belonging and relatedness and mattering in community, and a capacity to give back, to volunteer or to share the space with somebody else. It's really simple stuff, but that is the recipe for health promotion, getting what we need to take a little bit more control over our own health and the conditions for our health. And there has been a long period of disinvestment in that. And it's up to us to demonstrate again why, for millennia, humans have been taking care of one another in this way. And so I really, really want to thank, in particular, Dr. Nada Hassan and a group of Masters of Public Health promotion students from the University of Toronto who were out there talking to people on the regular, collecting data about how they feel about being in the space and what it means for their health. So could you stand up, please, because I know you're here. Thank you so much. Woo! Yeah. And I know they would agree that public space is public health.
There's a documentary on Netflix I've been recommending to folks called Join or Die. I don't know that Kate would approve of the tone of the, it doesn't sound like a strengths-based title, but it does make the link between our personal health and our need to be together, and gives a great history of Bob Putnam's work, if they're a little cheeky with their marketing. Let's go to Julia. And I think, when I went through this report, the thing that probably surprised me most was how straightforward many of the recommendations were. And I'm wondering why that's not easier, and what actions are coming out of this that you think could be different than maybe they've been attacked before.
Well, thank you, Sharon, and it's an honor to be on the stage with you too. When Ilana reached out to us about partnering on this, we were kind of giddy because you'd already formed the partnership with Kate and Nada, and so much of the work that we do at Gehl is trying to develop new ways to measure what we care about and to gather data on the things that lead us to want to be in public space, to connect with others, that can be hard to measure and quantify. And we don't want the data just for the data's sake, but so that we can actually tell stories about the power of public spaces, and hopefully foster more appreciation, more investment in their design and management. And so for years, we've been developing different research on this, looking at the impact community plazas can have on sense of belonging. Candace has developed research on social connection in public space in New York City's plazas. But we had yet to formally partner with such expert public health leaders like Kate and Nada, and so it felt like taking a whole new step forward in this research to really pair the disciplines. And I think that interdisciplinary approach is such a key part of this. And so, yes, we got more data. And, you know, I did want to share just a couple points. Ilana alluded to some of them. But as mentioned, we looked at standard urban design features, right? They're standard. And there are guidebooks out there that tell you, you know, put seating, put the bike lane, make your sidewalk this wide. Like, we know what to do if you want to create a safe, comfortable street or space, but we don't see it happening, right? And I think what this shows, you know, by showing that 71% of people said public seating led them to more connections, 50% said landscape features like grass and trees increase their sense of belonging, 20% more social interactions at the interactive art installations, and there's more fun nuggets in the report. But what that helps to show is that these features are not just nice to haves, right? They're not just leading to a safer street where you're going to be more protected from vehicular traffic, which is important, and we need that, of course, it's baseline. But actually, these are public health tools that can help improve our mental health and our physical health, and that, you know, we hope can be more included into design briefs down the road. But why is this not yet happening? So often, you know, we find that in the planning and design world, we're still fighting against like an older paradigm that was really driven by engineering and aesthetic constraints that, you know, said things have to look this way and be this way because this is where the road must go. And those are also real practical concerns, and we love our engineering friends, if any of you are here. And we partner with you too, and maybe that's the next project, is bringing an engineer on. But experience in space, how you actually felt using a space, even a building, was an afterthought, if considered at all. And so we, I think we have to invert that paradigm, and we have to make sure that we're leading with experience. What is the experiences we're trying to create? How do we actually want people to feel here? Is it going to be inclusive of the communities nearby, and who is not using the space now? So that's one thing I think that acts as an impediment. Another is that social outcomes are not often included in the design briefs that we as designers and planners respond to. And they could more intentionally be included in RFPs, in what a developer says must be an outcome of the buildings they're creating. Focus on social connection, physical activity. There's so many different social outcomes, and what the goals are should relate to the local community too. And then this work takes interdisciplinary partnership, right? And public space is so great and touches all of our lives because it is connected to so many things, and that means that we can't focus on it in a siloed way. So we need these partnerships across fields to really design and manage these spaces, and that takes intention, as you've talked about, resources, time, and an entity to organize all the different players there. So I think those are some of the things that we'll keep working against and have some ideas on how to address in maybe the next question.
So Ilana said in our original conversation about this that all of this is meaningless if it doesn't inspire action. And so us being action-oriented women up here, I thought that the last question I'll ask myself, and then I'll open, so be thinking about your questions. I'll be opening the floor up in a minute, is could each of you share 3 actions from the perspective of your different disciplines, because I think you're hearing interdisciplinary is a theme here, that you take from this report and you would implement right away if you could? Do you want to go this way?
Can you hear me okay? Okay, I don't need to press that button so vigorously. My thumb's a little sore. Yes, so some of what I'm going to share, I think, to this audience is probably familiar, especially to those of you who follow the Bentway's work, because you practice a lot of this. I'd say number one is just really, listening to the communities that you're working with and that you're working around, and understanding who's there, who's not there, what are the needs, what are the histories of people and place. As you mentioned earlier, Sharon, thinking about what is the land that you're on, and what is the history that it might share, and really understanding what that context is and being responsive to it. And second, I'd say we do have some universal needs that need to be addressed in public. When it's hot, we look for shade. When it's cold, we look for sun. When we're tired, we look for a place to sit. We want things to be clean. But those basic things, universal things, they don't come with a checklist. There's no number of elements that you need in a space, and how those features are incorporated need to respond to the listening that you've hopefully done, right? And that can inform what they should look like, where they should be, what is actually needed in that place. And then I think the third is that public space is part of a system, right? And the design is one piece of that system, but people are another essential piece. And the Bentway is also like a great example, right, of how to think about the context, work with the physical context you have. Some of the art installations, were so responsive to the height and the scale, did such a great job of engaging people in that space. And the programming is so huge. And so really investing in the people that maintain, program, manage these spaces is essential. And then I'm adding a bonus one because it relates to all of us, and that is to think about how might urban planners, designers work much more closely with much more intention with public health practitioners to develop some kind of certification program that public and private developers could use to really make sure social outcomes are part of their design brief and part of their designs. And we have programs like this in the architecture world. There's the well-designed standards, LEED design standards. Sometimes they can be used to greenwash, or we say like public life wash. They can be done in a one and done way. I think we all know we don't need more protocols or anything necessarily, but what they can also do is elevate the importance of this topic, bring it to a wider audience, and hopefully bring more resources to this idea of public space as a vital ingredient to addressing our public health challenges.
I love that. I love that bonus one. Kate, do you want to go next?
Yes, I do. It is hard to keep it to 3. But okay, so here's what I'm gonna say. I think number 1, I would encourage everyone to prioritize resilient relationships in the work that you're doing, particularly at that local, community, and neighborhood level. People who have experienced marginalization and discrimination don't really love being asked to be resilient, right? To continue to shoulder burdens after lifetimes of shouldering burdens. However, we are in a time of significant geopolitical change and significant environmental change, and we do need one another at that very local community level, and we do need to think about strong neighbors, right? I talked about, in our little moment of conversations about all the neighbors who came and shoveled my driveway when I was, stuck in Ottawa, and when we came home, we were all worried about where we were gonna park, and there was a driveway shoveled because we have a community of neighbors who do those kinds of things. And that was a big climate moment, right? Maybe not a huge climate moment, but a climate moment. And so I really think that we do need to think about that in the collective way and really prioritize those strong relationships going forward in a time of real upheaval and real change. Secondly, this won't surprise anyone who knows my work, I would say invest in social prescribing. It is a very low-cost intervention that really works. So we know that the kinds of things to which people might be prescribed, like spending time in nature, like engaging in arts and culture, like physical activity, so many of the things that the Bentway really supports and invites people into, they have huge health benefits, huge reductions in all-cause mortality, all reasons for death, huge reductions in risks around mental health, around cognitive decline, around physical health, cardiovascular disease, diabetes, you name it, these interventions work. And there is no shortage of capital, like actual capital, to invest in this stuff. I think we need to be honest about that. We are often faced with artificial scarcity, but we know, this kind of work can reduce the burden on the health system. It's worth their intervention. It's worth those dollars, right, to invest in this. And we're in a time, you might have heard of some significant healthcare stress and strain. And being able to help connect people to community not only reduces the workload for healthcare providers, but also improves their own sense of purpose, reconnects them to why they got into health and medicine, and makes them feel better about the work that they're doing. It's that little individual, like you said, Sharon, about like humanizing work that's become maybe overly bureaucratized over time, overly siloed, right? Overly directed and scripted, and to maybe take down some of those barriers. And then the last one I want to say is, might feel a bit more abstract, but I think it's really important, and that is to really, really know your history. Where do some of these barriers and silos come from? Why do we accept them as inherent? So in health, for example, people might often say, that's a provincial responsibility. Like, there's nothing we can do here municipally. And that's, first of all, not really true. There's lots of municipal health work that happens, and especially social determinants of health work. But also, it happened for a particular reason. At the time of Confederation, we codified a very specific idea about what health care looked like and for whom and where it happened, and it happened at the provinces. And then we're seeing in real time that those structures are not inherent and can be unmade, and maybe will be unmade by somebody else who has a different agenda. But if we are really thoughtful and intentional, and this one thing I love about the Bentway is that you tell your origin story, and your origin story is really different from some of those inherited silos. And it's a story of people coming together and trying to do something differently and seeing it materialize in the real world. For me, as a political ecologist of health, somebody who looks at the material expression of these politics, it's just amazing to see. So think about the history. Think about if there's a challenge you're facing, give some real consideration and do some research about where it came from, because that's going to give you clues about what to do next.
It's hard to follow. I'm going to start actually by sharing a secret, which I have never shared publicly before. And now I'm just realizing that this session is being recorded. So my background's in architecture. I was trained as an architect. And for a long time, I really believed that there was a real danger of over-programming a space, that you should create spaces that are inherently flexible, that if you rely too much on programming, it's a failure of a space. Then I took on the role as the director of programming at the Bentway. So clearly, I have changed my mind. But the most striking thing that was said to me during our research, which is now so evident, but it really took me by surprise, is that people are socializing differently, and they need explicit invitations to socialize. I think that COVID really strained our muscle to socialize, and specifically took away the spontaneity of that socialization. And it's not just COVID. There's just so many things that are competing for our attention endlessly, that the choice to just casually go out and do something and maybe happen upon something, you're so busy dealing with everything that's coming at you through technology or being asked of demands of you on work, on your personal life, that we just don't do it anymore. I see it in my kids, I see it in myself. But until somebody said that to me, that we need invitations, I just hadn't put a term to it. But I think as programmers, that's really important. That means that the work that we're doing is not just a nice animation of a space. It's a signal to participate, to share space with your neighbors, to engage in shared experiences. And if I can kind of summarize, or if I can leave you with one actionable item that is really, I think, the easiest, kind of lowest barrier thing to do, is don't underestimate the impact of a single volunteer shift. Every one of us can be a volunteer for one day, for 1 hour. And too often as programmers, I think we are seeing volunteers as a means to an end to delivering a project or a program, when really sometimes that is the impact. You'll have seen in our slideshows an incredible event that took place in September of this past year called Dominoes, once again led by my incredible programming colleagues here. And it was a simple idea in practice, incredibly logistically difficult to execute, but it was a 2.5 kilometer course of human-sized dominoes that stretched across the city and broke every rule that we know to be true of the city across streets. It moved in and out of private residences. It took half an hour from end to end for the fall to take place. But its significance was that it was built by a team of 300 volunteers. 40 businesses had to sign on to be part of it. It was a true community event. And hearing the stories of the people who participated, who came out as families to participate, who said, we don't have enough opportunity to volunteer with our children. I've met my neighbor for the first time doing this. I never knew that business existed until I was here as a volunteer and doing this. It forced them to see their city in a new way. They were invested in something that was bigger than themselves. It was a collective effort, and they took pride in that. And the impact of that was really profound. We're still hearing from people who are grateful for the opportunity. We were grateful for them for helping us to execute it, but equally they're grateful for us for helping to make it possible. So that's, the easiest thing we can do. Doesn't even have to require a single extra dollar. Let's ensure that we create opportunities for people to volunteer, and let's promote the importance of that for everybody involved.
I love it. I'm going to take it one teeny step further, because you've all touched on elements of, intentionally or not, of social capital that we have studied. And in our first report, I remember reading it and realizing that the highest quality of life self-rated within the survey, people would say, were the people in Toronto that knew the most of their neighbors. And I realized in that moment that I didn't even know the names of my neighbors. And so I made an effort after that report to get out there. Fast forward to this latest report, because I try and take something away. And this one, I absolutely freaking love this idea of animating spaces in terms of either downplaying it or upplaying it. And it isn't just volunteers, it's all of you. If you have anything left in the tank, my latest personal challenge has been to break into conversations with strangers in appropriate settings. But it's that same reason. You never know the effect you're going to have on that person and their day and the choices they're going to make as a result. But I feel like there's like this container that is the Bentway, where I want to come and do that kind of training live in beautiful, as I say, luscious shade of the Bentway. So enough from me. Questions for this illustrious panel? Oh, there we go. First hand. Oh, is it on?
Test. Hi. I'm Mariel. I'm an interdisciplinary artist. I work with a company in Toronto here called Blue Mouth Inc. We make interactive, immersive work. And I read the report and was really influenced by it from the Toronto Foundation, so thank you for that. And I'm familiar, I think, with many of your work, so really excited to be here. I also read Bowling Alone and was really influenced by that. And I've been thinking a lot about this notion of a thing that I see is missing, and that I'm thinking a lot about public spaces and in my life is my sister, for example, goes to church. I don't go to church, but I do go to the theater, and I've always said the theater is kind of my replacement for that. And so I make work, and I'll go to the theater center or another space and connect with people, and I love it. But what I don't have in my life that my sister has is if she gets sick, someone will come to her house and deliver a casserole. And I've been thinking a lot about joining the Rotary Club or the Lions Club and looking at reports of, Robert Putnam talks about the decline in social participation and volunteerism, and thinking a lot about, okay, Gen Z and millennials, we're not joining the Rotary Club, we're not joining Lions Club, so are the theaters, as an artist, what is my role? And perhaps as, on the panel you could talk to this, do public spaces and arts organizations need to fill that role? Is that something that you're thinking of, and that I should be thinking of, that we all should be thinking of as artists and arts organizations? Or is there more of a gap or a need for someone else to fill something that's clearly missing? That's my question.
It's a great question. Kate, do you want to take the first stab at this one?
Well, yeah, the answer is never somebody else. It's always you. So yes, I do think that there is huge opportunity for arts organizations and other organizations to play that role, and it's one of the reasons that that we know social prescribing really works. And so in our research, what we have found is that those people who go on to become volunteers, even in the simplest way of delivering a casserole, shoveling the snow, right? All those small things that we can do for one another, sharing a smile, like depending on what our physical abilities are and intellectual abilities and so on, those people by far show the biggest improvements in health and well-being. And partly it's because we shift our sense of self from a deficit perspective of I'm in need, I'm ill, I'm somebody who receives care services, to I've got something to give. And we all have something to give. And so when we connect people, we use whatever connections they have with institutions to help with that. So for me, it's in healthcare, right? You're in healthcare. I'm involved in a big project now that's about paramedicine, like people who are calling 911 because they're lonely, right? And using that moment as an opportunity to connect them better with a faith organization or a theater organization or another one. And in so doing, we don't have to make all of that very formal, but we just have to sort of light the spark again for, as Ilana has mentioned, like just being a bit intentional about reminding people the basic nuts and bolts of making friends and having relationships and all those things that we've just lost touch with a little bit for complex reasons. So I love that. I totally encourage that. I'm going to come to your theater/church group, and I will bring a casserole.
Do you have an answer for this one too?
Only just, in response to what I just said, art can very much be that invitation. And we see that all the time, especially when it's brought outside of traditional institutional contexts, and people don't have to make a decision to go to a specific space to engage with it. I mean, I think that one of the beautiful things about engaging or delivering public art, and the scariest things, is that there's no control over it. You're putting it out there, and people are going to engage with it on their own terms and however they like, but they'll do it in a way that is meaningful for them. So I think it's got tremendous value. We see it every day in our work with at the Bentway, the way people spend time with it, the way that they slow down, the way that it helps them to strike up a conversation with strangers or neighbors, the way they come back to see it again and again and create habits and traditions with the space. So absolutely, I think it has a very important role to play.
Next question. I saw another hand. Oh, back here. Kita.
Hi, everybody. My name is Kita. I don't know if you could know a guy called George Lakoff. I really like his work. He talks about how we frame. He's a framing theorist. So I'm sitting here and I think most of us agree with a lot of what he's saying. But what I'm struggling with is my friend who's a developer, who's only interested in how do I make money, or how do we frame this argument for those folks so that they get what we're talking about. So if we talk about like social outcomes, they don't care. Like that's just not how they see the world. I really struggle sitting here saying, okay, I'm converted, I completely agree, most of us agree, but how do we frame the conversation for that audience?
Julia, I feel like I'm tossing this one your way.
Yeah, well, thank you. Right. Yeah, I appreciate your question. It's a hard one, but I appreciate it because, as you said, right, we can all agree on things and then leave feeling like, where's the meat here? So that is the question, right? How, and I think, even we've talked about, right, a lot of times you see a public space or something, you think, well, how did the designers make X decision or Y decision? But often it's because of whoever paid them, right? And they're not the ones that hold those purse strings necessarily. And the development community, is often a really important stakeholder player in the shaping of spaces, and so is the public sector, of course, too. So, I mean, I think there's value, there is a lot, probably more, that can be done to tell stories about the power of these outcomes in terms of fostering greater community and greater value for a neighborhood. I mean, I think there are economic outcomes of these things too. That wasn't part of our study here, but that's something that we could get more data on. I think then there's also a role for the public sector, right, who sets some of that framing for development in terms of where zoning what kind of zoning goes where certain buildings can be developed, what they should not look like, but the functions they have. And there are guidelines around community benefits agreements, right? If you build to a certain height, you need to create X amount of open space. If you create X number of, new units at certain points, right, you have to contribute to community amenities nearby. And could mental health, social connection, well-being actually be included in what you also need to contribute to? But I know people also don't like to be told what to do, right? So perhaps there's an opportunity just to start a dialogue between those sectors and see what might be compelling.
Go ahead.
I was just going to build on what you said. I do think that the public sector has an important role to play. I know that, for unconventional projects like the Bentway, we're always asked to make the case on an economic benefit. How does a project like this end up producing value for the people who live along its length? How does it drive tourism? How does it drive spending? And I think that part of the reason why you're asked that is because those are tangible numbers that you can deliver. Like they're quantifiable metrics, and you can say, yes, I have achieved success, or I have achieved impact. So this is the beginning of work, and there's many others who are working in this space to try to communicate community health benefits in the same way. But I don't think we should be afraid of metrics and impact measures, because it's important to speak the language that we know people respond to, and it's important to broaden the conversation about impact beyond solely economic impact. It's environmental impact, it's health impact, we need to be evaluating these projects on a number of different levels. But how can we ensure that we are speaking in a language that people understand and can equate in equal measure to things like economic impact?
So I totally agree, and I'll also say, I teach public health advocacy and have been doing this work for 20 years. Here's the reality. The economic argument, the economic evidence is necessary, but not sufficient. It's a checkbox for people. What they really want to know is that there's an expert there who is accountable, who will say, I think this is going to work. And I think people are going to like it, and I think it's not going to make life harder. Like, so much of what we are proposing as innovators to people, it needs to just say, this is going to make your life easier. as a decision maker, as a funder, as a programmer. That's the kind of thing that gets you in the door. So, saying that it's not going to make things way more expensive is important, but beyond that, it's actually not very impactful or persuasive. So I'm perfectly fine with telling people what to do. I think it is okay for us to have some regulations and just say, look, you gotta think about sustainability, and sustainability means having strong relationships, and this is just the basic core measures of human life. They're not that controversial. And so again, it has to happen in multiple ways, and in complex adaptive systems, we're just gonna all be doing it in our own ways. But here's the thing, when I go on the radio and talk about social prescribing, I will always get an email or a phone call right after saying, I need this for my mom. I want this for my neighbor, right? This is something that I want right now. And that is going to be just as impactful with your developer friends who have a mom and have a neighbor and have a friend who needs this, and maybe they need this. So, if we are thinking about humanizing it, it might not be as tricky as we think to do a bit of a combination of changing the rules, incentivizing with, certifications and trophies and badges and all that fun stuff, but also just sort of remembering that they probably want this in their own lives too.